to the Community Clinical Care podcast, broadcast from Shropshire in the UK. On this podcast, we're going to be looking at some recent changes to the UK Sepsis Trust's Sepsis Screening Tool, particularly the one for adults in community care. If you're looking at our visual presentation on YouTube, you may well be able to see that we've got the old version and the new version alongside each other. But if you've not got visuals in front of you, hopefully we'll do some explaining to highlight all the changes. Working from the top of the tool downwards, right at the top there, they've added in section 1 to consider any advanced directives and care plans, which I think is a really interesting point to have right at the top there, because we're aware that some of our patients in the community have these quite robust care plans in place, and escalation to 999 or to the acute care just isn't in the best interest or within what the patient wants within their care plan. So definitely consider in the bigger picture of patient care before running through the red flags in particular. But that's not to say that a patient who has a new form of illness or infection or potentially sepsis shouldn't be escalated to medical care. It just means consider what that pathway may well look like for your patient. On the old tool in section 3, where it's asking if we've got any red flags present, I notice a box has gone, and that's have the patient had recent chemotherapy. That's been removed. It doesn't appear in the newer version of the tool, and there's probably some very good reasons for it, which I'll come down to when we come into the amber flags. But previously, I think having recent chemotherapy in there with a patient who may well look ill because of any kind of infection, it may well have been a little bit vague. It may have resulted in quite a lot of patients being admitted to 999 or acute, and perhaps they didn't need to. So I think they've moved that one down into the amber flags there and badged it under immunocompromised, which we'll come to when we discuss that in a little bit. In the red flags box number 3, we've had a little bit of a change as well. Previously here it said, does the patient need oxygen to keep their SpO2 above 92%, brackets 88 in COPD? That's now changed, so they reworded that to, is there a new need for oxygen, brackets 40% or more, to keep SpO2 above 92 or 88 in COPD. So I think that this now rules out those long-term oxygen therapy patients where they're on very small amounts of oxygen, just sort of keeping their sats up. They're typically our retaining patients we may well see in the community. I think there's possibly opportunities for this misinterpretation of that in the past using the old tool, whereas now it's a little bit more robust, where it says if there's a new need for oxygen of 40% or more, it's clearly that is now an acute need rather than a chronic need, and hopefully it's a little bit more clear for clinicians out there in the community that if things have changed, that's what we're interested in, not whether or not they need their O2 chronically. So yeah, I think that's quite a sensible rewording there. If we come down to the amber flags, so section 4 on the tool, there's a few changes here. It's both in wording and in content as well. So where it used to say, are the relatives concerned about mental status, that's been reworded a little bit more plain English, I think, into family report abnormal behaviour or mental state. Now, that's really interesting, isn't it? Because in some of our elderly cohort or our patients with learning difficulties might see a change in behaviours before we see a change in mental state per se. That's really, really important, and we see that in some of our community teams who are using the Restore tool, and some of our care homes where they're using these soft signs a bit more. They're a bit more wary of changes in behaviour rather than what they may well term as mental state. The second one, where it used to say acute deterioration in functional ability, is a little bit wordy. They've just changed that to reduced functional ability, and I quite like that. I always describe this one as could this patient perhaps make a cup of tea last week and this week they can't? That to me is a functional ability. It could be interpreted more along lines of mobility. It could be in terms of their ability conducting themselves. But I think it's really open to your interpretation, and also it's going to need a really good conversation with family or carers to determine the speed of that decline, whether or not it's acute or subacute or even chronic decline. But really interesting change of wording there. I mentioned earlier where they removed chemotherapy from the red flags. There's an interesting change in words in the amber flags here. So they've got rid of the word immunosuppressed and they've changed it to immunocompromised. It's a bit more of a used word, I think. Immunosuppressed I haven't seen in many patient notes recently, but I have certainly seen immunocompromised. And this, to my mind, is where the sort of neutropenia or recent chemotherapy consideration would now fit. So if you've got a patient who has had chemotherapy or any other kind of immunotherapy, the considerations now as amber flags are part of the bigger picture, aren't they? Part of the holistic care of that patient. So is a patient who's going to look really ill? Well, if they're not flagging in terms of the red flags at the moment, it's definitely still a consideration for that pathway, but it might be more of a slower pathway into GP or your own team leads or your own clinical top cover. Lastly, on the amber flags, there's one more change, which is signs of infection, including wound infection. Now, I think this is really interesting. So back right at the top of the tool, it asks you if your patient looks unwell or they're abnormal, and could it be due to an infection? And one of those is a skin or wound infection. And that's then repeated down in section 4, so signs of infection in the wound. So firstly, it's asking, could it be due to an infection right at the top? But importantly, we don't need to know if that's a yes or a no. It just be, could it be? And secondly, down in 4 is asking specifically, are there signs of infection around this particular wound? So we don't need to know if a wound has become the source of a systemic infection. We just need to put 2 and 2 together that there may well be a systemic infection and it could possibly be the wound. But we don't need any massive clinical confidence to link them at this point. Underneath the amber flags on the new tool, it's a little bit more robust in the way that the tool now describes that we should safety net these patients. So before it just said no amber flags equals routine care. But now it says no amber flags equals routine care and safety netting advice. The assumption here is, I suppose, that these patients, we may well be seeing a deterioration at the early stages of it happening. And it might be something that's on a course to get worse. Really, really important, therefore, that our safety netting is in place, whether that be by our own teams revisiting, whether it be by escalation to the GP or a team leader or ACP or doctor, or whether or not it's agreed that the care home staff or family may well take care of this patient and report back any changes to us. So safety netting is actually added in 111 as well. So call 111 if condition changes or deteriorates. Now, I suppose that depends where you're going to be working in the community, because this tool is designed for all of us in community healthcare teams, but also for our care home care providers and also carers in the community. So it's a bit of a catch-all tool. So the 111 might be better served by you taking on board your own top cover arrangements. I like the fact that they've then included the FAST test. So if the patient may well have stroke symptoms of slurred speech, extreme shivering, muscle pain, passing no urine perhaps, or I feel like my day. So some of those, to my mind, overlap with what we might see in a neurological problem. Notice, so slurred speech, confusion we might see in a neurological problem. But also it's saying that actually if you don't think it's an infection that's behind all this, you still need to call 999. So the sepsis tool has now gone beyond the realms of infection to, it doesn't matter what the source of this problem is. If you think that these symptoms are there, definitely worth calling 999, regardless of whether or not you know it's an infection. Now, perhaps most importantly, down the bottom is the red flag bundle. So it's now the community care red flag bundle. It used to be the community nursing red flag bundle. So importantly, it still says dial 999 if you think there is a red flag. Arrange that blue light transfer as soon as possible. However, it's now changed to include, if there is a prescriber available, and the transit time is greater than 1 hour, we're to give IV antibiotics. Now, of course, this is going to vary depending on where we are in our services, but in some of our community hospitals, in some of our hospital at home or virtual ward teams, we may well have access to these antibiotics. And there is some evidence which upon this is based that it is worth starting the process of giving those antibiotics as soon as possible. We're all aware of the delays with ambulances at the moment. This is a response to that problem, which is national, I'm afraid, at the moment. So we must still ensure that we've said to 999 this is a red flag sepsis. And as a healthcare professional, they will then probably ask you for a News 2 score as well. These two go hand in hand. And interestingly, don't forget that the red flags on News 2 go hand in hand with the red flags on the sepsis tool. They're basically the same things. So any red or 3 score on a News 2 score will score a red flag on the sepsis bundle as well. So I hope that's been a little useful look at the changes in the UK Sepsis Trust community care tool. These are available on the UK Sepsis Trust website. They're free to download, and there you will find other tools for different age groups and also different locations of care, such as GP surgeries or pre-hospital for ambulances, things like that. But in terms of our community healthcare, we're going to look to the community care tools. So thanks for joining us on this episode. Hope you've enjoyed it. Feedback is greatly appreciated. We will be developing more podcasts in the future, and if there's anything you'd like us to cover, please do let us know.